Fine. Going live. If you have any questions during any time of this presentation, just put them in the comments. Let me know anything I can clear up. There's going to be a lot of information every single time I do this presentation. I always learn a lot for myself. And you're watching this video because you're struggling with constipation to some degree. I had a lot of chronic constipation in the past, in my 20s and 30s, and I just pushed it off for the longest time. I just thought that, well, this is part of my life. I have to deal with it, and I did not know how to fix it. That was a huge problem. I tried different medications or different herbal blends, and they would work to a certain degree. Then eventually they all stopped working. It was just a roller coaster, up and down, up and down. Sometimes I could get a bowel movement going, and other times, maybe I had to sit around for a couple of days. It started with just 2 to 3 days, then it became 3 to 4 days, then it became 4 to 5 days. It was very unpredictable. And going to the doctors and going to different online forums did not really work. But I started to learn about my body, started to learn about human physiology for myself, start to look at this picture right here, started to learn how does the digestive system actually work. And that really helped me on this journey. Today we're going to cover a lot of information. We're going to cover human physiology, trying to break it down to the simplest terms. Then I'm going to give you a lot of practical pessimism about different medical conditions from minor to severe that could happen to you if you do not resolve constipation to the fullest. Next, we're going to jump into different forums, online, maybe Facebook groups, other people that had tried this, that, and the third, and they are not working. What are the mindset that they're currently experiencing right now, the pain, frustrations that they're experiencing. I'm going to make some analogies. Then I'm going to jump into some different protocols that could be very applicable for you, and a specific protocol that I've been using over the last 5+ years. I've helped myself, my family members, and also hundreds of other people how to resolve constipation. So this routine, this detox routine, became a normal part of their life. Coming back to this picture, let's take a quick look what's happening here. When we're looking at human physiology, it could be very intimidating at first because you do not know what you're looking at. It's going to break it down to you in the simplest terms. Now, food enters your mouth, down the esophagus, into your stomach. In your stomach, you have your digestive enzymes start to break down the food. Then food will go into your small intestines. Your small intestines is very long. It's 4.5 meters. Followed by your large intestine, which is another 1.5 meters in length. So right here, this is the ascending portion of your colon, the transverse, and the descent. I do not care who you are, where you're from, your skin color, religious backgrounds. When it comes to the digestive system, we're the same across the board. Now, some people, they may have longer digestive system just because they're much taller. Some people are much shorter. But long story short, you gotta just take a quick look at your alimentary canal. This is your digestive system. They call it an alimentary canal, which means nourishment or food. Your food travels through a very long piece of pipework. Now, once again, food enters your mouth, down the esophagus, into your stomach. Digestive enzymes start to break down the food. Food enters your small intestines next. Small intestines 4.5 meters, followed by your large intestines 1.5 meters, and out the back for defecation or elimination. The combined length of your small and large intestines is roughly 6 meters or 20 feet. Just putting into perspective, I always relate this back to basketball. A lot of people, they may like to watch basketball, and I can do some comparisons, make a quick analogy. We're looking at this guy, at the dunk contest. From that floor to that basketball rim is 10 feet off the floor. 10 feet is roughly 3 meters total. The combined length of your small and large intestines is equal to 2 of those. So you got one NBA hoop. Okay, just thinking about it, you're looking at this NBA hoop, you're trying to jump, and you cannot even touch the rim. Now, you got to go another one on top of that, So that's 20 feet. 20 feet, it's roughly 6 meters. Over here, you got one stack on top of another, and that combined height is the combined length of your small and large intestines combined. It's a very long piece of pipework. Now, what is chronic constipation? There's just simply a lot of waste material that is not exiting out of the body. Looking at this photo, we have a colon that is full of trash, full of fecal matter, and we need to go from the picture on the left to the picture on the right, and that's how you resolve chronic constipation. Now, what was happening to myself? The frustration, daily frustration that I had was simply this. I could be sitting on the toilet for a very long time. I'm straining, I'm huffing and puffing. I got these veins popping out the side of my temples. And what's the end of all that work? A little bullshit sheep pebble pellet. That's all I got. And I'm sure a lot of you experienced to a certain degree. Now, what happens when your old poop accumulate inside your large intestine? When your elimination is incomplete, residues of old feces can build up in layers on the walls of the colon. As they putrefy, they can cause health problems, pain, and discomfort. The definition of putrefy is simply decay and rot. There are things decaying and rotting inside of you right now as a result of chronic constipation. Now, constipation, this particular keyword is very interesting. I know a little bit about internet marketing, and before I target this product or service, I want to know there's great interest for, is there demand there? Now, I can guarantee you, people all over the world are keying in constipation in Google, in Bing, whatever search engines they're using. This keyword has never contracted. It is a recession-proof keyword. Doesn't matter if you're keying this in the English language, Spanish, Portuguese, Russian, Tajik, Arabic, Chinese. I do not care. Hundreds and hundreds of languages over the world, people are keying that into some type of keyword analysis or search engine. They're looking for answers. They don't have answers. They try this, that, and the third, and nothing is working, and things are just progressively getting worse. And how do they know they're progressively getting worse? Well, before their constipation was 1 to 2 days, then it became 2 to 3 days, then it became 3 to 4 days, and some people are going into an entire week without a bowel movement. Chronic constipation, waste material, not exiting out of the body. Now I'm going to give you a lot of practical pessimism, a lot of it. Now this is a toxic megacolon. What happens when waste material is unable to exit out of the body? You may end up with a toxic megacolon. Now this is a life-threatening complication of inflammatory bowel diseases. These diseases can be painful and cause permanent damage to the large and small intestines. Now these IBDs include ulcerative colitis, Crohn's disease, and infections caused by this other colitis. Toxic megacolon is characterized by swelling and dilation of large intestine, and due to the inflammation and accumulation of large amount of gas. Now, as we're looking at this photo, I can tell you that this is probably more than just gas you're dealing with. It is hardened, old fecal matter not exiting out of the body. The accumulation is going to make your colon continue to dilate. The doctors don't know what to do with you, and eventually they have to extract. They have to remove this whole colon out of the body. This is not Animal Planet. This is not the colon of a silverback gorilla. This is the colon of a human being that just continued to expand over time, causing all sorts of inflammation. And now the doctors had no way, but now they just have to completely extract this colon out of the body so the body can, live on. Now, I'm going to give you a lot more, a healthy dose of fear. As you can see, well, if they remove the colon, what happens next? You may wonder, right? So over here, we're dealing with a very long piece of pipework. Now, food absorption takes place in the small intestines. Now that pushes into the large intestines for feces formation. And this is where the large intestine also draws out water. So the feces formations takes place and out the back for elimination. After this colon removal, they may have all sorts of other surgical procedures. Now, depending on what you're dealing with. Sometimes it's a partial colectomy, and that's the key word I want you guys to learn. This is a left hemicolectomy. They removed the descending portion of the colon over here, so they removed this portion, and then what they do after is they reconnect it from this part to this part. There's a lot of plug and play in the medical industrial complex. Okay, when something is wrong, they're trying to just connect different parts together. Over here, you have a colon, and this is the later part of the colon. This is the tail end part. They only remove this portion. Okay, now what happens next is that you have to get some waste material out of the body. You have to have a way to get the waste material out of the body, and they put a hole in the colon right here, and they put it back. This is called a stoma. In some cases, after the surgeon removes a portion of the colon, it may be necessary to attach the remaining colon to the outside of the body in a procedure called colectomy. Creating a hole, stoma, in the abdominal wall allows waste to leave the body. A colectomy, colostomy bag attaches to the stoma to collect the waste. So you may see patients, I don't care if you go to the hospital, really, you can look at the ICU, just spin around. You may find different patients, they have this attached to their body. Now over here, we have a right hemicolectomy. So something went wrong with the ascending portion of your colon. Okay, the ascending portion actually comes up on your right side. Okay? And when you guys just learn these and just really relate it to your own physical body, you can say, where is the pain and discomfort? Is it the ascending portion of my colon? Could it be the transverse or the descent? Because these are all categorically the same for every individual. And see me as a brother instead of two distant strangers, just like Tupac said. Okay, so over here, a right hemicolectomy has been performed. This is where the small intestine is attached. Okay, so small intestine gets your stuff into the large intestine. So what they did in this procedure, they removed this part. Okay, but over here, you still have the small intestine hanging around. So what do? They do that plug and play again. They just attach it right to this section here. Okay, so digestion continued to take place, and over here, feces formation, out the back for elimination. Now, I think this is called ileoanal anastomosis. Now, what happens over here? Over here, you have the complete removal of the colon. Okay, so the colon's completely removed, but they still need to somehow get the waste material out of the body. So what they do is they start to do more plug and play. They created a pouch over here, attach it to your anus area. Okay, so they remove your colon and your rectum, and your surgeon may connect your small intestine to your anus. This allows you to expel waste normally, although you'll likely have several watery bowel movements daily. As I said before, the large intestine draws out water from the feces formation, so your bowel movements can be somewhat compact. Now, some people, this has been sitting in their colon for too long, so this becomes hardened. But over here, you have a problem where, listen, you may have to wear adult diapers for the rest of your life. Okay, things kind of just flow through you so quickly, and you have no sensation of, oh, I'm going to have a bowel movement coming on. It's just thinking about how do you even wipe this thing properly. It's just constant waste material oozing out, and as a result, you may have some really foul body odor that you cannot control. You have no control over. Now, I'm going to check around my social media, making sure everything's running correctly. And if you have questions, I just pop them into my comments. Let me know. Over here. Over here, we are live. Okay, so over here, if any questions, put them in. Let's check my, okay, that's also working. So I'm gonna post this real quick. Rumbling, rumbling. So none of this professional medical advice, diagnosis, or treatment. You guys got to find the right protocols for yourself, okay? And you may take pieces of what I teach and you want to learn, see how you connect with other information, whether you're learning through books, working with a naturopathic doctor, or think integrated medicine, okay, maybe with your physician, your GP. You guys got to get the waste material out of the body, okay? That's first and foremost. Talked about different liability concerns moving forward, a healthy dose of practical pessimism. What else can happen if you don't fix chronic constipation? You may find your colon severely displaced. Now, coming back to our photo, okay, because we're learning about human physiology. A lot of you are watching this for the first time, watching my channel for the first time. You're not sure what you're dealing with. So colon over here, ascending portion, transverse, and descend. With a healthy colon, this should be the shape of your colon. So ascending, and you got the transverse, and it has a slight uphill, before the descending portion comes in and out the back for elimination. Now, this lady in Taiwan, she was only 23 years old. She already had a severely displaced colon. You can see on the scan, her colon was all over the place. It's kind of got a kink in the hose where the colon went up and then back down into a loop. And over here, it has to climb back up again. Because she's been chronically constipated for so long, this colon has dilated, it's displaced, it's contorted, and now it's all the way up in her chest area, kind of like a roller coaster. It needs to climb up against all this, against gravity, and finally down for elimination. Many people suffer with this, okay? And they try all different types of things to resolve. Maybe they try some probiotics, maybe they try laxatives, and we'll talk about those as well in the later of this presentation. Now you have diverticulitis. This is another thing that could happen to your colon. And I'm just reading these. These are from different medical texts. And this could be from, the Mayo Clinic, whatever. Doesn't mean I agree with everything that they say. I'm just saying this is what they're trying to tell you. And I'm telling y'all, they don't really have a good solution to resolve any of these problems. Diverticulitis is a gastrointestinal disease. It occurs when pouches called diverticula start to form the GI tract and become inflamed and affected. This condition commonly occurs in the Western population and can be seen in 10% of people over the age of 40 and 50% over the age of 60. The rate of this disease typically increases with age. Scientists believe that this condition is due to not eating enough fibers. Not enough fiber leading to constipation, which puts extra pressure on the colon walls, and this causes diverticula or bulges to form in the weak areas of the colon. The risk factors for diverticulitis may include age over 40, male, overweight, eating a low fiber diet, eating higher fat and red meat, not enough exercise, taking non-steroidal anti-inflammatory drug like aspirin, ibuprofen, steroids, opioids, and smoking. Moreover, the signs and symptoms of this condition include pain, tenderness in the left lower side of the abdomen, nausea, vomiting, chills, cramps in the lower abdomen, constipation or diarrhea, and rectal bleeding. What a complete mess, right? Now, I want to challenge this a little bit because many elderly, they have chronic constipation, which means there's unresolved waste material currently sitting in their colon. My grandmother had chronic constipation, and the doctors told her the same thing. Eat more fiber, or has some type of products that you drink down that has fiber in it. Does it work? No. Should continue to suffer chronic constipation because until you can remove this waste material, you're packing more waste material back into your system, continuing to dilate that large intestine, continue to have more problems putrefying on top of you. So that I want to challenge that. Doctors always say, it's because I'm not eating enough fiber. Right now, that's not your key problem, okay? What else can you have if you're dealing with chronic constipation? You may experience ulcerative colitis. So let's learn this real quick. What is ulcerative colitis? It is a chronic condition that happens when you have inflammation in your colon. Okay, you have an ulcerative surface causing inflammation. Most people usually experience periods of symptoms flare-ups, followed by periods of remission without symptoms. Signs and symptoms include diarrhea, bloody stools, abdominal cramping, and weight loss. Treatments include medication and surgery. Okay, so what do doctors usually prescribe when somebody has ulcerative colitis? They prescribe a lot of corticosteroids, immunosuppressants, or biologics. Now, all these different types of drugs, they work very similar. They're immunosuppressants, which suppresses your symptoms flare-ups temporarily. Does it solve the problem? It doesn't really solve the root of the problem. Oftentimes, you go to the doctors, they always say that, oh, this could be something with your genes, you have this predisposition. Now, I'm just saying it may have something to do with chronic constipation. What is Crohn's disease? This is another gastrointestinal disease, part of the inflammatory bowel disease. This condition occurs when there's inflammation in the small intestine and colon. So now we're not just dealing with the colon, we're dealing with the small intestine and the colon. The main symptoms of Crohn's disease are diarrhea, stomach aches or cramps, blood in the stools, tiredness or fatigue, and weight loss. It is thought to believe Crohn's disease is caused due to genes, a problem in the immune system, smoking, a previous stomach bug, and an abnormal balance of gut bacteria. The risk factors for this condition include family history, smoking, certain medications like antibiotics, birth control pill, non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, and a high-fat diet. But you can see the symptoms are very similar, right? Doesn't matter if you're talking about diverculitis, doesn't matter if you're talking about Crohn's disease, you got these stomach aches or cramps, blood in the stools, right? Diarrhea, chronic constipation. What else can happen if you don't deal with chronic constipation to the fullest? You may experience something called rectal prolapse. As people, they are huffing and puffing, begging and pleading, straining on that toilet. They're putting a lot of pressure on their anus, okay? And over time, their rectum is going to prolapse. It's actually going to turn itself inside out. A lot of elderly people deal with this on a daily basis. They just want to have their meals and use the bathroom in peace, but they have none of that because they cannot have that proper exit of the bowel movement. So this is a daily struggle for many elderly people. Now, what I've researched over the years is that this is becoming more and more common. This is not just reserved for people that are older in their 60s. This could happen in your 50s, 40s, 30s, and even 20s. This is another problem that's also very common. Anal fissures. Okay, a fissure is some type of a breakage, a crack, or splitting. And over here, they are having a type of a split, some type of a cracking, splitting in the anus area. It could be very, very painful. Okay, and when you go to the doctors for these things, they usually tell you, oh, there's no clear-cut cause. Doesn't matter if you're talking about rectal prolapse, an anal fissure. However, an estimated 30% to 67% of patients have chronic constipation, infrequent stools, or severe straining, and an additional 50% have diarrhea. In the past, this condition was assumed to be linked to giving birth multiple times by vaginal delivery. However, as many as 35% of patients with rectal prolapse never gave birth, and it can occur in men. There might be some genetic predisposition to this condition. In other words, some patients are more prone, based on their genes, to develop this condition while others don't. I want you guys to re-examine everything, question everything, including this presentation. Why should you just take the words of somebody else? Are there other information that is beyond your current scope of awareness? It's completely off your radar screen. And we're going to talk a lot about those today. Now, I also had hemorrhoids at one point. What a mess, right? So these are internal or external hemorrhoids. These are swollen veins inside your rectum or outside of your anus, which can cause pain and itching and rectal bleeding. So when you have that combination of discomfort, let's just say you're itching around that area due to hemorrhoids. You may scratch in that area, and over time, because it could be so persistent, you want to scratch, but you know the more that you scratch, you may experience rectal bleeding. Symptoms often improve at home treatments. Preparation H, that stuff stops working, okay? But on occasion, people need medical procedures. Eating more fiber can help prevent hemorrhoids. Brother, please, listen. I want to teach you guys what is a proctologist. A lot of people don't know these are highly specialized medical doctors. They're also called colorectal surgeons. They diagnose and treat conditions of the entire gastrointestinal tract, but specifically involving the rectum and anus. Nobody looks forward to seeing their proctologist, okay? Because they're dealing with this area right here, right around this anal area. And when they see that, oh, you have this problem, that problem here, they may go for some procedure. They say, oh, no problem, we're going to cut this out, patch you up, stitch you up, and you'll be well on your way. Unfortunately, if you don't resolve the problem upstream, which is chronic constipation, you're still stuck with a whole bunch of fecal matter. Eventually, you're going to experience chronic constipation, and you're going to keep sitting on that toilet for a very long time, straining, okay? And all those conditions are going to come back. And then what do the doctors say? Oh, it's because you're not eating enough fiber. You have a genetic predisposition. I just want you guys to challenge that. That's all. I'm going to spin through my social media a little bit before I go on to the next part of my presentation. If you have any questions, just type in your questions. Okay. Type in your questions on my YouTube. Maybe you're watching on my Facebook. Type in your questions here. I don't even know if my streaming is working well, whatever. It says it's live. Is it really live? Or is it really behind? So I'm going to close down some of these windows. Maybe they'll help with the streaming. Okay. And coming back in here, give you guys some more liability concerns, practical pessimism, their entire Facebook pages, different Reddit forums you can find. Because these people, they've already went through the doctors, they've been through all the different clinics, they went to the specialists, and they still continue to have chronic constipation. A lot of these post as anonymous members. Sorry to be crude, but there's a big lump of poo that won't come out. What do I do? Any other ideas? Suffer from chronic constipation. Suffer from constipation now and again, especially when I have been eating crap for the past couple of weeks. I've been constipated. When I go to the toilet, nothing is coming out. Or if it does, it's hard. I've also been bloated, especially upper tummy, and like a trapped wind feeling plus since yesterday. Not really got an appetite. Try Ducales. Okay, this is an OTC. Never really worked. Eating more healthy and now trying lactulose since Tuesday, but feel like it's just making me fart. Also to mention, having some stress and anxiety with family members been in the hospital. What can I do to help get my tummy back to normal? Thanks. Many people struggle with this. Consultant has put me on perchloride and glycerol suppository. Any reviews? So after the OTC stuff stopped working, you go to these specialists and they give you, prescription strength medications. And from my experience, reading these different types of forums, the reason why people are on these forums because they've already done all that path. They've already tried so many things. Still not working. Hi everyone, had a horrible couple of days. A lot of wet would come out and I couldn't just push out what was behind. And I just couldn't push out what was behind it, but after many attempts making me sore, I finally did go. What I wanted to ask is, do you ever feel queasy to your tummy because of constipation or bowel problems? Sometimes I think it's all the worry and stress that constipation causes. So it's not a physical thing, your physical health and your emotional health is directly tied together. Okay. Over here, You have people that are vomiting fecal matter. Has anyone vomited fecal matter because it couldn't go down? What did you need to do about it? Please go to the ER. This is dangerous. So you guys can look up feculent vomiting. As I discussed before, this is very, very rare, but it does occur to some people because, let's just say, they're chronically constipated, right? They're really, really backed up. Nothing is even pushing into this ascending portion for whatever reason of the colon. And sometimes it starts to backfill. It starts to backfill through the small intestines. Okay, just imagine you're dealing with this. A lot of fecal matter starts to backfill into your small intestines, starts to work its way back into your stomach, and you have something called reverse peristalsis. Peristalsis usually push food down. Okay, now you're doing reverse peristalsis, and you're basically vomiting out the fecal matter. I'm impacted. All home remedies, OTC laxatives, enemas, dietary changes, additions, nutritional oils quit working last month all of a sudden. The ER couldn't reach it, and their enemas didn't work. The highest dosage of lenses does nothing, and the Miralax colonoscopy prep is just giving me overflow diarrhea. Small bits are coming off the impaction, probably from the hospital enemas that got Saturday. What else can I do? I feel like the impaction is just way too big to get out, and it seems like nothing is softening enough. Many people have this problem. They've already done so many different things. Sometimes they just have to go to the ER to get a little bit of temporary relief. Now, this video is really for people you're only 1 to 2 days chronically constipated. What is chronic constipation? It's simply you're not going to the bathroom every single day, consistently, like clockwork. That's got to be your important daily KPI, a key performance indicator to tell you, okay, my health is somewhat on track. Maybe it's not perfect, but I have waste material elimination on point. And that's going to help you resolve all these other problems and help you avoid. Look at what other people are experiencing right now, because they pushed their chronic constipation. They just thought, oh, it's no big deal. It's only 2 to 3 days, 3 to 4 days. And now they're really, really impacted. They have no idea if their colon's really dilated to a really dangerous point or it's been displaced, okay? This one I really want to read and give you guys that healthy dose of fear. Hello, I've been struggling with severe chronic constipation for a couple of years now, and it's only gotten worse over the last 6 months or so. I've been prescribed Trulance and Linz's highest dosage for both, and neither of those medications are working very well for me at this point. I can pass a little bit of stool, but not much, so I'm constantly extremely backed up. I have to spend about half my waking hours lying down because I'm so bloated and nauseous, and often in pain. As far as OTC laxatives, nothing really works there. Dulcolax, enemas, suppositories, magnesium citrate, nothing works. I was supposed to have a colonoscopy today, but couldn't keep the bowel prep down. The procedure had been rescheduled for a month from now, and one of the nurses at my GI office prescribed a pill-based cleanse. The pill is called Sutab, and I was warned ahead of time that patients often have trouble completely emptying their bowels with this pill. So given my struggles, I am doubtful that this will actually work for me. Here's my question. Has anyone here gotten to the point where nothing works, meds or OTC laxatives, and had to have some sort of in-office medical procedure done? I'm so sick and so miserable. What about professional colonics? I'm not even sure how those work. I will discuss about those today. If anyone has any advice or experience with this, I'll be very grateful if you could share with me what you ended up doing and what the outcome was like. Thank you. So if you're watching this video today, you're extremely blessed. Maybe some of you are watching this video after the live recording, and you want to deal with it as soon as possible. I'm very grateful for YouTube videos because it was a YouTube video that helped me get rid of chronic constipation. So this is me kind of giving back and sharing with you what's worked for me. and giving you all the background information, human physiology, okay, liability concerns, okay, practical pessimism, because other videos don't really deep dive into these type of problems people are experiencing and all these different screenshots that I've collected, and they just continue to pour in, man. Just look around on different groups. You will see these are some of the most active groups on Facebook, because these search volume doesn't lie. Okay, the keyword analysis that I did, it does not lie. Thinking about your digestive system, I want you to think it from a mechanical standpoint. Having this mechanical eye to look at your body is extremely helpful. Let's just say you're having a problem with your garbage disposal. It no longer works. You must fix that garbage disposal or get somebody to fix it, or you're going to have many problems in your kitchen because garbage disposal is not working, so there's all this trash stuck in this garbage disposal, and over time, it's going to putrefy. It's going to decay and rot, and all that smell is going to invade the rest of your house. Another way you can look at that, your digestive system is just plumbing, right? You have your toilet, water in, water out. Now, if children, they don't know what they're doing, they're throwing some of their favorite toys or action heroes down this toilet, and they try to flush it down, and you don't know any better, you use the restroom, and now you are dealing with poop that is overflowing the toilet. Okay? And that's what chronic constipation is like, because this waste material must go through this pipe and down into the sanitary sewer. It has to happen that way. If it doesn't, your whole house will be reeking with fecal matter. Now, that lady previous was talking about colon hydrotherapy. I'm going to discuss about it. This is not something I have done before. Okay? I had a friend in this industry. She told me it helped her tremendously, even though she was living a very healthy lifestyle already, but she said it also upgraded her health. Now, all this is you're laying down here on this apparatus, okay? And then the colon hydrotherapists, they're putting in hot water through your back end to help escort out all this dead and waste material inside the colon. So this water is going to be about the same temperature as your body temperature, because your colon has been encrusted with this fecal matter. Now they have to put this in, trying to clear out all this waste material. You can find a lot of videos on this on YouTube, on TikTok. People there are sharing exactly what they do, and you can actually even see the waste material that is exiting. Now, a lot of people are not just getting the waste material out. You're going to see other organisms during this colon hydrotherapy, which we'll discuss a little bit later as well. So I'm just going to take a little bit of break, get some water. Now, I also want to mention it's important for you to communicate very well with a colon hydrotherapist. A lot of people, they are chronically constipated. You need to really write down, okay, this is what I've been eating and how frequent are my bowel movements, because if the colon hydrotherapist is not experienced and they're putting in this water pressure too quick, you may get a perforation in the colon. So your waste material is oozing outside of the colon, and you may go into sepsis shock and end up in the ER. I am not joking. There is a risk if you do any type of protocol. Okay, I don't care if it's a colonoscopy, I don't care if it's colon hydrotherapy, I don't care if it's the protocol that I'll be sharing in a little bit. There's a risk if you do any protocol, and there's also a risk if you do absolutely nothing. And there is a risk if you just rely on these medications doctors give you. Because I'm just telling you, tens and thousands of people have already gone down that path, and nothing is working. Now I'm going to share with y'all what I do on a weekly basis. So this is something that I know from practical understanding and also personal experience, because a lot of people, they're just sharing these theories. They tell them to do these exercises. They tell them to use pressure points, okay? Tell them to do yoga. I'm not saying there's no merit to them. I'm just saying this is what worked for me, myself, my family members, and hundreds of people that I have coached over the years. These are the ingredients that you need. Very simple. This is apple cider vinegar. You want to buy apple cider vinegar without any sugar. Then you're going to find some type of citrus fruits. You can use limes, lemons, or grapefruit. I've been using grapefruits for the last couple of years. They taste amazing. They have a little bit of sweetness to them. Then you're going to use pink salt, or you can use food grade Epsom salt. So write that down. You can use pink salt or food grade Epsom salt. Black coffee is separate and optional. If you don't drink black coffee, that's perfectly fine. Now, when you take down these directions, very important. You might find other self-flush protocols online, but if you read through the comments, a lot of people still fail, okay? Because they're just not following the directions, or they're just haphazardly mixing things together, or they're not drinking the self-flush solution in a specific way. And I'll share with all these little details with you so you do it right, because I can give my recipe to a complete stranger across the world, and they're very successful with it. So, first time. So this is exactly what I do. The night before, you're finishing dinner around 7:30 p.m. You're not eating any late night snacks. You can still drink some water. You can still have some liquids, but you're not eating anything. Next morning around 11 a.m., on an empty stomach, make this in thermos. When you wake up in the morning, you're not eating breakfast. You can still have some liquids. That's it. But you're not eating any solid food. You're not eating any congee, nothing. Okay, just keep your stomach empty from food. At 11 a.m., you want to make this in a stainless steel thermos. Here are the ingredients. I just gave you the ingredients, but I also want to give you some tools that you'll be purchasing after this call. Okay, so over here, you need a plastic bottle of water. It's about 2 liters in volume. This is a metal mesh strainer. You need a single press squeezer. It just makes things a lot easier when you're squeezing the citrus fruits. Next, you need some measuring spoons. Okay, it's got to say the amount of milliliter on those measuring spoons, because measuring spoons can vary. Depends on where you are in the world. This is apple cider vinegar. This is pink salt. You can get a lot of pink salt if you use pink salt a lot. This is the stainless steel thermos, and you want to buy ones that has over 1 liter in volume. Okay, and the ones that I buy, they have a very, very wide mouth, so the solution can cool down fairly quick. Over here, here's another mug for black coffee. Notice how I use things you cannot break. That's very important. Okay, so you're adding 1 tablespoon and 2 teaspoons of pink salt or food grade Epsom salt into the stainless steel thermos. So that's 25 milliliter total. Next, you're going to cut and squeeze 3 lemons or limes or 1 grapefruit. Completely filter it through the metal mesh strainer so there are no seeds or pulp. You don't want anything that you're going to choke on. You want to make the solution as smooth as possible. Next, you're going to add a 1/4 cup apple cider vinegar. Okay, and you want to maybe pour it through the metal mesh strainer so there isn't any sediments that goes into the solution at all. So 1/4 cup is 60 ml. Then you're going to add 2.5 cups of hot water, roughly 600 ml, and you're going to stir that up. You can stir 30 to 45 seconds, making sure the salt dissolves evenly in the stainless steel thermos. Then you're going to add a cup of room temperature water to bring back down the temperature and continue to stir. Okay. On your table, there should be only 3 things. So after you put all the ingredients in the stainless steel thermos, you mix it up. Okay, you just clear out all your table. You're going to have a bottle of water here. You're going to have a stainless steel thermos. And you have black coffee, completely optional. You don't need to drink it. The reason why you want to use objects that you cannot break is because I'm going to clean out your small and large intestines. It's going to create an incredible laxative effect. In the process of doing so, you may use the bathroom multiple times, and then you may knock things over. Okay, I don't want you to knock anything that you can break, because if you do, now you're going to have shattered glass on the floor. Okay, you just run into the bathroom. You're going to trip, and now you're going to cut yourself. Now you got glass all over your body. You go into the ER from doing this. And the ER is like, what the hell is wrong with this person? This person's shitting out of his pants. Okay, got glass over his body. What the hell did you do to yourself? And you said, well, I watched this YouTube video online. Listen, don't even mention my name. I already told y'all. Don't use anything that can break. Go to invest in a nice stainless steel thermos. This is how you're going to drink down the salt flush solution. Very specific. Now, you had the bottled water, salt flush solution, and the coffee. And before you start drinking any of this, you want to be a very calm, collected, relaxed state. Maybe you listen to some classical music. I listen to Rachmaninoff, Piano Concerto 2, Movement 2 on repeat. Some of you may find another piece of music that you like. That's going to give you that calmness. And you're breathing very deep into your stomach, so your stomach is moving up and down. That will help the salt flush solution travel through the small intestines. Now, when the temperature of the salt flush solution is somewhat cool, I would say it's not burning your teeth. As long as you can put it down, you can begin drinking it. Okay? You're going to take a tiny sip of this water, the bottled water, hold it in your mouth. Then you're going to take a bigger gulp of the salt flush solution and drink it down. Okay, that's the routine. Then you're going to sip on a little bit of black coffee. This is completely optional, taking a tiny sip, because if you're like me, I drink coffee. Now, the coffee is going to be a familiar taste. When you first start drinking the salt flush solution, you're not going to like it because it's salt, all right? It's apple cider vinegar, and then it's grapefruit, it could be limes or citrus. It's a very weird taste. If you do not like the taste, you can also buy yourself a stainless steel straw that can help you put down the salt flush solution, kind of evade the taste through the tongue. Once again, you're sipping on the bottled water. Okay, take a tiny sip. You're not drinking the water, you're taking a tiny, tiny sip. Then you're taking a bigger gulp of the salt flush solution, put it down, and then you're taking a tiny sip of the black coffee, put it down. Okay, and always come back to deep breathing. Coming back to deep breathing. Letting go of expectations, letting go a lot of stress and worries. Don't make any plans in the afternoon with your friends because you don't know how long you've been going to be on that toilet, okay? And of course, once again, this is not professional medical advice, diagnosis, treatment. I'm just sharing with you what's worked for me over the past over half a decade. I've been doing this once a week, just once a week, just like doing maintenance on your body. I mean, you brush your teeth every single day, right? I mean, you shower regularly, right? You go to your mechanic to get your car maintenance. Now, have you thought about cleaning yourself on the inside on a regular basis, getting rid of the waste material out of the body? Your goal is to finish the salt flush solution first. Your goal is not finishing this and this at the same time. That is incorrect. You're going to dilute the solution. Wrong way to do it. Taking a tiny sip of this water, taking a bigger gulp of the salt flush solution, tiny sip of this coffee, reward yourself, repeat this whole process over and over, but the goal is to put down the salt flush solution first. If you have any discomfort, that you're feeling that the salt flush solution is coming up your esophagus, you want to throw up, then do nothing. Just put everything down and just deep breathing, relax until those feelings and that feeling of nauseous, want to throw up, subsides and goes away. And you continue to drink. But the goal is to put down the salt flush solution first. So what's happening is that this is a solution that you drink down, right? This is not an enema. You may find a lot of information online regarding coffee enemas or even water enemas. I'm not about that. I'm about drinking it down, okay? So it's coming down through the esophagus into the stomach, creating a very relaxed environment, and the salt flush solution is going to go through the small intestines, begin cleaning that up. Your small intestine is 4.5 meters, and it has a surface area of a football field. It has so much trash accumulated inside this pipework. Most people are very, very unaware. They don't know how to clean out this pipework. And it could be stuck with a lot of microplastics as well. So your nutrient absorption is very, very weak. Doesn't matter if you're eating the healthiest organic foods or the highest grade of food grade supplements. You're not absorbing it because you're full of microplastics in the small intestine. Now, this sulfur solution eventually is going to push all that waste material and they're going to push it into your large intestine, and you may feel some bowel movements coming on. Okay? You're never trying to strain on the toilet, all right? You're going to just relax, sit on that toilet, and you're going to have this unction for this waste material to come out. And when you first start doing this protocol, you're going to be shocked because it's going to come out very, very dark color. For me, it was pitch black. It was like charcoal coming out because I was so impacted. I was encrusted with fecal matter in the large intestines for a very long time. Solids are going to first come out and you just relax, okay? And over time, you're going to have soft poops that's going to come out. It's going to become softer and softer, and the smell of this is absolutely horrendous, okay? You got to warn your family members in advance. You got to get some fans, okay, working. You got to get the ventilation, get that window open. Now, when it transitions to really, really soft poop, I want you to continue to pound on this water safely. You want to drink this water safely at a pace that you're comfortable with, because I'm adding more water pressure through the digestive tract to punch out all this debris that's been accumulating in your small and large intestines combined. Okay? And this protocol is not for everybody, right? Because it could be very unsafe for those of you. You're so impacted, right? This is for somebody, not professional medical advice, that you're only 1 or 2 days constipated and you want to fix it right away. Because if you let it sit for too long, you know how people are dealing with it going forward. And when you start doing this, when it starts to spray, you continue to add this water pressure, you're going to produce a diarrhea tsunami. It's just going to blow up your toilet, okay? It's going to be incredibly nasty. So I want you to buy some cleaning agents in advance, okay? And because it's completely nasty. I mean, just sometimes you go to a public restroom and then you're like, oh my goodness, somebody blew up this toilet, and you just walk right out, okay? You're gonna blow up your own toilet in the most, I would say, 4th of July way. It's gonna be like fireworks, okay? And I'm just gonna spin through my social media, see if any questions. Yeah, people watching on my YouTube, welcome, welcome. Don't be shy, just ask your questions. And see me as a brother instead of two distant strangers, because we're all the same on the inside, okay? We all have to eat, okay? We all have to have bowel movements, because we're all built the same on the inside when it comes to the digestive system, categorically. I want you to also examine this product. If you don't want to buy this product, it's fine. You got to get some type of a stool. It's going to help you create this angle, okay? Because human beings, we are designed to use the bathroom in a squatting position, not at a 90 degree. This modern toilet has caused so much pain for people all over the world because we are not meant to use the bathroom at a 90 degree. So a lot of people, they're not having a complete exit of their fecal matter on a regular basis. There's always some type of trash that is left at the very tail end because we were not meant to build. We're not built to go to the bathroom at 90 degrees. So get yourself some type of a stool where you can just get the squatty potty. I don't care what you do, but get yourself in this 35 degree. And another thing that you can do is I want you to lift up this toilet seat. The toilet seat is not helpful at all because what it does once you sit on it, it squeezes your butt cheeks, right? Once it squeezes your butt cheeks, it's gonna constrict your anus. Now, the best is that if you can just get a squat toilet in your own home where you have access to one. I have a friend, he's very wealthy. In his home that he designed all by himself, I think he did it for his parents. They have a regular toilet, but they also have a squat toilet. So it depends on what their what they want, because they know the squat toilet is much more effective. You just get into that squatting position and everything comes out, in one go. So you're not straining on the toilet trying to divide and conquer that fecal matter. Now, after you do this selfish protocol, okay, you're going to notice this water color that comes out of your back end. It's going to become lighter and lighter and lighter. So what exactly just happened? You just pushed out all the waste material from the small and large intestines. The selfless solution that you drank earlier is already in the toilet, okay? And just continue to drink this water to add more of that water pressure to continue to clean out this pipework comprehensively. I've been doing this for the past 5+ years, and that's what's helped me. My family members, they had this problem, that problem, and a third, went away. Hundreds of people online. I've helped people this with English. I help people in Chinese. I live here in Taiwan. I've helped hundreds of people here in Taiwan. And after you do this protocol, you want to eat a little bit of probiotics. Just relax. Don't have any major plans. You may have to rest, okay? Because the first time you do this, you don't know what to expect. And you may have water that want to exit out of you a couple of hours, even after the self-flush protocol. But you want to eat a little bit of probiotics. The probiotics is going to recoat back up your small and large intestines, okay? Let me tell you, a lot of people, they are messed up with whole sorts of colitis, ulcerative colitis, because let's just say they've been taking a lot of antibiotics, okay? The doctors prescribe a lot of antibiotics. Now their microbiome's completely messed up. They're devoid of probiotics. You see how that works? So now you got the pipes completely cleaned out. Now you recoat it back up with probiotics. Then you start eating healthy foods. You can't go back to the trash eating you've been doing for I don't know how many years. You got to go back to foods that you know what they are, because they're from nature. They don't come in a box, okay? They don't come just through microwaving. You got to get away from all that types of food, because it's the processed junk that's been causing you all these problems over the years. You're not going to notice it right away. It's always gradual, right? And before you know it, you're so chronically backed up. And this is where we talk about, hey, you got to be eating some healthy fiber. But not before you resolve chronic constipation. And you're going to find yourself going to the bathroom a lot more often. You're like, oh, I feel I have to go. I'm just going to go. And you continue to stack healthy foods one after the next, okay? You're not going back to the trash eating. Let me tell you, I tried going back to the trash eating, and my body revolted. It was like a civil war. I felt awful. For the longest time in my old nutrition plan, crap eating, my body kind of just says that, well, this guy's been bullying me for such a long time. I'm going to stop giving him all these signals. I'm going to stop giving him any warning signs. And my body just continued to deteriorate over time. Now, I just want to spin through my social media real quick. If any questions, type them in. Don't be shy. Be happy to answer any questions. Maybe some of you, you're already working on your protocols, right? You're doing these detox protocols, and you just want to learn more how you can improve your health. I don't know which stage you're at. On this channel, I'm going to give you more practical pessimism, liability concerns. You want to have a sense of caution, because there's so much information that's currently off your radar screen. Because they're off your radar screen, you don't think that they exist. So when different problems that may pop up in your body, even the doctors have no answers for. I've seen videos where people that go to the ER, they're in so much pain and discomfort. Doctors run all these different type of tests, and at the end of all that ordeal, the doctor says, "We can't find anything wrong with you." Okay, let me tell you something. The doctors overlook internal parasites. I'm going to go through them in detail today. And There are many different internal parasites. Okay, I'm going to go through some major ones, and this is a topic most doctors don't even talk about, and we're going to talk about them. Now, some people might say, well, I live in the US, I live in Switzerland, live in very, very nice places, first world countries. These things are just only reserved for third world countries. Incorrect. In the US, if you go to Whole Foods market, people are finding parasites in their Whole Foods salmon, okay, or their Costco salmon. And today I'm going to talk about different parasites and the different types of risks that are in your everyday life. This is a liver fluke, these are pinworms, this is a tapeworm, and these are roundworms. Let's talk about their life cycle. Okay, all these things you guys got to continue to do their own research. Don't just take my word for it. You need to continue to go to the library, go check out some books. Okay, you guys can go read up on these studies, learn about their life cycles and how they could be incorporated into your life without you even knowing. So the life cycle, this is very simple. They have these eggs and they are hatched in water. And parasites, they have a way of upgrading themselves from one organism to the next. These are called intermediary hosts. So these parasites first attack a particular snail, and they will extract the nutrients out of that snail and grow to a certain size. After they grow to a certain size, they're hunting, they're finding something bigger. They exit out of the snail and find themselves in some type of vegetation, such as watercress. Now you have cattle, sheep, cows, they come through, they start to eat this up, and now these parasites continue to survive inside the beef, inside this cow or the sheep. You can talk to anybody in the cattle industry. I don't care if they're in North Dakota, they're in Colorado, they're in Australia, they're in New Zealand. Talk to anybody in the cattle industry, in the sheep business. They're going to have to deal with liver flukes almost every year. They're seeing how their livestock are getting weaker. They may be losing hair, getting sick. Well, there are parasites sitting right inside of them, extracting their minerals and nutrients while surviving and replicating. Parasites are very good at doing two things. Write these down: survival and replication. Okay? And if you are eating raw steaks, if you are on that Liver King diet, just eating raw liver, you have the risk of getting parasites. Or just raw meats in general, fancy restaurants, steak tartars, Korean barbecues. Anybody that knows me know that I can eat a lot. Okay, I go to a buffet by myself, and they give you a time limit, right? As Korean barbecues, it's different places that you go, so you're always rushing. Well, when you're rushing and cooking at the same time, you may be dealing with a lot of undercooked meats. That's what happens. People that are eating a lot of intestinal products, anybody that has to work with these intestines, cleaning them up to prepare them, they have to deal with a lot of internal parasites. They have to clean them up. Raw fish, sushi, sashimi, or even hot pot in Asia, a lot of parasitic activity. Okay. Next, we're going to talk about the tapeworm. You have beef tapeworms, pork tapeworms, and also fish tapeworms. Once again, their life cycles begins in water, and they just go up the food chain, right? They enter some type of crustacean, and the crustacean gets eaten by a smaller fish. The smaller fish gets eaten by a bigger fish, such as salmon, and now this thing ends up on your dish as raw fish. And you eat this raw fish. Now this parasite continues to survive inside of you. This is what they look like under the microscope, but these are full-blown organisms. They can grow to an incredible size. Looking at their anatomy, this is their sucker, and this is the rostellum. This is where they attach to your body. The suckers are kind of like I'm gonna have a nice foothold, inside your small and large intestines. And the rostrum is where they leach the nutrients from you, the vitamins and minerals. And this is how they reproduce. They have a lot of these things called progonids. Inside a single progonid, you can have up to 100,000 eggs. If you have 1,000 progonids, we're looking at 100 million eggs. These are full-blown organisms, like I said. You have a 59 feet long tapeworm removed from Thai man's rectum. Pics go viral. All right, 59 feet. Just how long is 59 feet? Is 18 meters. 18 meters is how long. Okay, I'm going to come back to the basketball court. Looking at the basketball hoop, right? Over here, just one basketball hoop from that floor to that basketball rim is 3 meters. That parasite is 18 meters. 18 divided by 3 is 6. So you got 1, 2, 3, 4, 5, 6. And they continue to survive inside of you, replicate inside of you. Okay? And this is a topic most doctors don't talk about. I'm going to go to my chat boxes real quick, making sure there are no comments. Facebook, okay. All right, coming back to the presentation. A keyword I want you guys to look into is zoonotic diseases. Zoonotic. I think that is how it's spelled, but I'm gonna just double check. Okay, zoonotic, zoonotic. Different diseases that are able to spread from animals to humans. All right, and parasites is definitely one of them. A lot of your pets have parasites. This is a tapeworm being extracted from this cat. All right, this is an American bully full of roundworms. We'll talk about roundworms in a little bit. And you have a cat. There's a parasite inside their nasal cavity getting pulled out. This could be a botfly. And you want to study up on the life cycle of a botfly. It's absolutely crazy. I know it's more common in Africa, but I just want to say that, hey, if you ever traveled out different parts of the world, you may be infected. Okay? Now, zoonotic diseases can happen and take place from your animals to your pets, to yourself, because a lot of people, they're doing these cute little videos online. They are so close to their pets. The pets are licking them, okay? And they're very, very close to them. You have no idea what your dog's been doing all day. Some dogs are so stupid, they eat the feces of other dogs. And now they're coming up to lick you. You don't know any better. Your kids certainly don't know any better. The different risks are the different raw foods that you're consuming. Even raw vegetables, such as raw watercress, carry risk, okay? Or if you are doing that travel thing, wanderlust, you might be in the Amazons doing your ayahuasca ceremonies. Or if you're in Indonesia, in the jungles, looking at ancient Buddhist architecture, well, if you're not prepared, you don't know how to filter water, you don't know what to bring with you, and you're just drinking the local water, well, you may get infected, right? Even malaria is parasites. Go look it up. Malaria, parasites. There are different parasites. There are single-cell protozoans, and they're extremely, extremely problematic. Now, what can parasites do to your system? They can cause a lot of obstruction. Just give you an example. Let's just say if you are overrun by these roundworms, and roundworms are very, very common in your pets. They've been in your body for a very long time. They've been surviving and replicating inside of you. And once again, this is not Animal Planet. This is a human being. And the doctors did a scan and they found all these roundworms inside this person's digestive tract. So they had to remove it like spaghetti. This person was experiencing stomach cramps and pain, nausea, swollen lymph nodes, digestive problems including unexplained constipation, diarrhea, persistent gas, skin conditions such as rashes, eczema, hives, and itching. And when you're dealing with a combination of these things, oftentimes you're prescribed corticosteroids, immunosuppressants, suppress these symptom flare-ups. But what is the root of the problem? I'm just saying, have you looked into internal parasites? One by one. Now, this is roundworms being extracted from the human liver. Roundworms went outside of the digestive tract and begins to attack your internal organs. And your liver is definitely part of your digestive system. Now I'm going to go through some different herbs, medications, OTC, precision strength that may be helpful in getting rid of your internal parasites. So look these up. There are combinations, there are herbal blends online, but you got to talk to your doctor, right? Naturopathic doctor, integrated medicine. Find what works for you specifically. So this is clove bud. They've been a popular treatment for parasitic infections for centuries. Or you can use wormwood. This is another traditional herbal medicine to treat different parasitic infections. This is OTC. This is called mebezoidal. Now these are OTC medications that could treat roundworms, whipworms, pinworms, and hookworms. Okay. So there's a lot of different meds that are out there, but for most people, this is off their radar screen. They have it's not in their knowledge base at all. Once again, this is mebezoidal. Here in Taiwan, this is OTC. You can buy it at any pharmacy. Next, you have black walnut and wormwood. This is in tincture form. Another wormwood combination. For your pets, looking to panic or see for your dogs, and you want to find the right size, depending on how large is your dog, how big is your dog. Fenbendazole for your dogs, and then there are also medications for your cats as well. Because dogs and cats, both of them, they could be loaded with parasites, and your kids are just playing with them all day, right? Or you're playing with them all day, making cute videos, and now those parasites are going to get into your system. Over here, these are prescription strength, the ivermectin, or you got to find doctors prescribe some of these medications, albendazole, and this one, something else. I think this one could help with single-cell protozoans. So that's a whole different thing, right? The parasites that I'm talking about today are ones you can see with your natural eye. Even without a microscope, they can grow to those very long sizes. Okay, even pinworms, you can be seen with the natural eye. So let's talk about pinworms are also very common. You see a child scratching their behind, or even adults, scratching their behind. According to PubMed, this particular infection is affecting almost 1 billion people worldwide from all socioeconomic classes. 1 billion. That's a lot of people. But is it being highlighted by your doctor? Do they tell you to look into it? Do they tell you to go test for it? No. That's why you have to be proactive, and don't just take my word. You have to find more information. So there are many different medications, OTC, prescription strength, herbal blends that can help you get rid of parasites. Now, just because you know about these different things doesn't mean that you should jump into this detox protocol right away. My sincere recommendation is that you first learn how to clean out your small and large intestines combined. Earlier in this presentation, we talked about how you can clean out this pipework comprehensively, not just the large intestine, but both the small and large intestines combined. You have the consistency in, you know how to get that waste material out. Detoxification is simply getting the waste material out of the body. A lot of people are just focused on supplementation. Supplementation is, oh, you must be missing this, you must be missing that. Get this vitamin, get this mineral, buy my supplement. That mentality. I used to fall in that category too. And I no longer fall in that category. I say detox first, then think about how to supplement my body. Get this pipework completely cleaned out so you have the confidence after you take those anti-parasite medications, because once you take those, you're going to have a whole bunch of dead parasites sitting inside of you. And you got to find a way to flush out all the dead carcasses. Think about that. That's why I want you guys to do this in the right order. You have the ability to clean out this pipework. Doesn't have to be using my protocol. Okay, you find a protocol that works for you. Once you have the confidence of doing that on a consistent basis, you know what to expect. Then later on, when you go to take these different types of internal parasite medications, you get rid of them, but you also have the confidence of, okay, after I take these medications, herbal blends, I have the confidence of flushing out the dead carcasses. Very crucial, extremely crucial. So let's take a quick look on my comments. I may Alright, so I want to share a little bit about who I am. I'm just another regular guy. My name is John, and I teach people how to clean out their small and large intestines. I tell people it's about weight loss, but I think that the more accurate thing is if you clean yourself on the inside, your body's going to rebalance back. This is me before in Southern California. I had a personal trainer, workout plan, went to 24-hour fitness, still not getting results. And until I start to clean myself on the inside, this is what I look like all throughout the year. I haven't even gone to the gym for years because I know how to clean myself on the inside. I eat healthy foods, okay? I went from this to this, okay? And it's been a journey. It's definitely been a process, and I want to show you guys how you can do it too, okay? Over here, what will you get in my program? You can learn more about my story and the introduction to the digestive system. I'm going to give you my shopping list. This is how you make the self-flush solution. Do this exactly. How do you drink the self-flush solution? How to poop professionally. What to do after the self-flush. How to get rid of internal parasites. Okay, that's what I teach in this program. There's so many other things I can teach you guys later on. For example, I also know how to clean your internal organs, your gallbladder, your liver. I know how to do that. And for the past couple of weeks, I've been cleaning out my kidneys, also using different protocols. But the first thing, you got to keep the first thing, which is cleaning out the small and large intestines. Critically important for you guys to get that down first before you move on to other protocols. So I think this one, I don't know if it's still working. I want to share with you some of these testimonials people have been sending me over the years. If you want to connect with me, there are a couple of things you can do. You can follow me on Instagram, follow me on YouTube. But if you want to work with me one-on-one, I think that will be very helpful for you. And kind of discuss, I want to learn more about you, where you're coming from, how I can assist you on your journey to vibrant health. Because that's what we want. We all want to achieve our goals, right? And whatever goals that you may have, could be relationship goals, it could be financial goals. You're not going to reach your goals without vibrant health. There's no way. Most people, they're kind of just going through life with a lot of pain and discomfort, and that's not the way to live, okay? You want to learn how your body works and start to ask yourself a different set of questions The doctors are telling me this and this and this. They're prescribing this and this and this. It's really not working. Okay? I'm just getting referred from one specialist to the next. What other problems could I resolve? What other problems am I overlooking right now that I can fix? That will be a great starting point to your health recovery. I had to ask those questions. I've read hundreds of books on natural health. Okay? I've visited different naturopathic practitioners over the years. I've helped different supplement companies sell their products. Okay? And there's only a very few people from my experience that actually know what they're doing. There are very few people that talk about detox. There are many people that talk about supplementation. And for you to recover your health, understand how your human body works from a mechanical standpoint. So you got to brush up on your human physiology. Okay. There are many books that are out there. Go to the archive.org, check out different books for free. Go to the Library of Congress online. There are also books on there, many excellent books, because human physiology is not going to change. So you don't have to buy the most brand new books. You can buy used books, used college texts on this topic, and you will learn so much. And today we only covered one system. There's so many other systems of the human body. And I'm not even doing a very good job explaining there's so many other intricate things to your digestive system, which I'll discuss later on. I'm just so grateful that I've learned so much over the years, and I continue to learn, continue to apply. As I make these videos, it also gives me more insight to how I can improve, different things that I can do to better my health. So I'm sending that through. If you're on my YouTube, just type in any questions you may have regarding digestive health. If you're dealing with chronic constipation, just go back and forth with me and tell me, hey, what are you dealing with right now? And more importantly, what have you tried so far, right? So I can help navigate maybe through some of the problems you're having right now. I'll give you some insight, or I'm just checking through my social media today. I'm testing across Rumble, I'm testing across my channel on Rumble. Yeah, this is, experimenting with streaming, I think it's definitely challenging. I have so many interesting things or interesting topics for to share going forward. For example, today we only talked about this pipework, okay? Esophagus, stomach, small intestine, large intestine, that's it. But there's so many other components to your digestive system. For example, this is your liver. It plays an important, crucial role. Over here is your pancreas, okay? Everything is connected. These are all part of your digestive system too. And since 2023, I've been releasing a lot of gallstones out of my gallbladder, and that has been a huge transformation in my own personal health as well. And that's also something that is off most people's radar screen. They don't know that, oh, I don't have to go for that surgery where they remove the gallbladder. I can actually clean this out. But recognizing that, listen, you can't wait too long. You can't push things off. You have to assume that, hey, I probably have gallstones right now. I need to get rid of them. Because some people, they wait until it's too late. This is actually a gallbladder. What we're looking at is actually this piece right here. The person has, you know, so many gallstones, and now they're just getting this gallbladder attack, getting their sharp pain. Finally go to the hospital. The hospital, they cut this whole thing out. They remove it. So you have no more gallbladder. Here's another photo, gallbladder. When it's full of gallstones, getting the sharp pains. The only thing the doctors really do is they remove the whole gallbladder. I'm saying is, listen, you may want to get these gallstones flushed out of your body naturally before all that stuff happens, okay? And there are ways to do it. Once again, this is not theory. I don't like to share a bunch of theory. I like to share things that I've done that I know very practically, and I want to explain it in a very practical way, okay? Catch the early signs of chronic constipation and fix it early so you can avoid a toxic megacolon, avoid hemicolectomies, avoid this procedure here, avoid colon severely displaced, avoid diverticulitis, avoid ulcerative colitis, avoid Crohn's disease, avoid rectal prolapse, avoid anal fissures, avoid internal and external hemorrhoids. Doctors are like waving their hands. I don't know why you have all these problems. All I'm saying is it could have something to do with chronic constipation. Could. Okay. So thanks so much for watching this. Oh, we got 3 people on. You guys have any questions for me? If you have any questions regarding digestive health, just put them in the comments. Well, I'm not seeing any questions here, so connect with me. I'm going to leave my program in the comments below. You guys can get my program. If you want to work with me one-on-one, just DM me on my Instagram. I'm going to jump on a call. Just want to learn more about you, completely free, and see if it could be a good fit working together. Because a lot of y'all, you have no accountability. You don't know how to follow through on anything. And you have no urgency. And you like to push things off until it's too late. So that's why you pay me the big bucks. So it's actually on your radar screen and you want to take actions with it. That's what happens. So thanks so much for watching this. You have an amazing rest of your week. And just connect with me on social medias and ask your questions. I can follow up in the next video and kind of follow up on your question. Thanks so much.